Judith Aronson Ramos, MD, is the Medical Director of Development and Behavioral Pediatrics of South Florida. Specializing in early prevention and diagnosis, she brings a wealth of knowledge and experience to the Autism Channel. Here is Dr. Judy.
We have the pleasure of welcoming Stacey Hoaglund today, who is a mother of a child with autism, an advocate and an editor, a woman of many hats. Welcome to the show.
Thank you.
So I think it would be nice for our viewers to hear a little bit about all the many things you do, because you do so many, and then we'll pick out a topic or two that might be of interest to our viewers.
Okay. Well, first and foremost, I'm a mom of a young man with autism who's about ready to graduate high school, which is amazing. Amazing, very, lots of hard work, so it's been great. A lot of intervention. I'm also an advocate, so I attend IEP meetings and help families through the process of diagnosis all the way through making sure that they have what they need in the school systems. I'm the past president of the Autism Society of Broward County.
Okay.
I'm on the board for the Autism Society of Florida. I sit on Special Needs Advisory with the Children's Services Council. I'm also the editor of the Autism Notebook magazine.
That's enough.
I know. It just goes
How do you do all this? So
Yeah.
let me ask you, because there's often a personal connection. I've shared with some of the viewers my personal connection. I have a 19-year-old daughter with autism. Obviously, you have a son, and I'm guessing that's what launched you into this whole field. Yes. How do you feel that that helps you, especially in your role as an advocate with families?
I think that it sort of works both ways. I think that certainly having a child with autism gives me a very unique perspective to be able to advocate for families, having gone through it all myself. And certainly, like other parents, I learned on the way with him and how to figure out what I needed to do. But I think it also helps the other way as well, because I learned things by working with families, particularly of older children, knowing that my son is going to get there one day. So it helps me not only with the others, but it also helps me be a better advocate for my own son.
Now, you recently published an ebook about IEPs and IEP goals, and we've discussed in other programs an IEP is an individualized education plan. What kind of bullet points do you have for families about that whole process and making it work? Because I know in my practice as a developmental pediatrician, when I'm having a family call an advocate, usually it means things are not going well, or they're having trouble. So how do you advise families to make that process work without it being so adversarial?
Well, we don't get called when things are happy. So it's, there's always an issue. But I would say 90% of the time it's because of lack of good communication.
Okay.
Because a lot of times teachers might be very well-intended, parents are well-intended, but somewhere they started to butt heads, maybe in methodology. Or a parent thinks they should have certain goals and the teacher doesn't. So usually what I have to do is go in, sort of size up the situation to see, communication-wise, where's the breakdown? And then once I discover what that is, and it may be that the child's really not getting what they need, then I work with the family on educating them on what's available, what's out there, what types of services are available to meet the needs of their child. School districts are not allowed to say, well, we don't have enough money for that, but yet that's a lot of times when we get those calls, that's what a family tells us.
Which brings us to another topic which you've worked in as well, which is legislative action and what's happening politically and what's happening with insurance reform. And unfortunately, with the state of the economy, I'm finding families are struggling more across all the levels. One being their insurance plan won't cover the services they need, and then the school districts don't have the funding. So how would you summarize the status of things legislatively in terms of insurance reform? Do you think we're there? We're not there?
No.
Nowhere.
we're not there with insurance reform. In the state of Florida, the law that we have for insurance and people with autism is better than what we had before, because we didn't have it before. So it is better than not having it at all, and it does allow parents to go through the appeal process, because parents are still being denied. Even if we've got this legislation, they're still being denied services covered by their insurance. But there's an appeal process. So I tell families all the time, don't accept the no. This is where your skills as an advocate for your child needs to come into play. Because, if I find that overall, if strong parents who learn how to advocate for their children can have amazing things. They can find amazing services and see tremendous growth in their child. But many, many, many families don't know how to advocate, don't know that if they advocate, things can actually change. I even will have teachers tell parents how to advocate, because teachers sometimes are locked down.
Absolutely. And you know what? Hold that thought. We'll be back in just a moment. More with Stacey.
From the studios of the Autism Channel, we return to Dr. Judy.
We're back with Stacey Hoaglund. So Stacey, we were talking about some of the insurance issues at the state level in Florida, but our viewership is pretty broad. People will be seeing this show all over the country, and I was wondering, for their benefit, is there any federal legislation regarding autism and autism funding?
Well,
funding of therapies.
Combating Autism Act.
Okay.
So has lots of promise, so it's brought around a lot of dollars looking towards services, different types of interventions, which is huge, because it's not all about finding the cure. We have hundreds of thousands of people living with autism today, so we need to make sure that we have the services and supports that they need to have a better quality of life, because right now, for a lot of our adults, the quality of life is not there.
Right.
Also, there are pieces of Obamacare that provide applied behavior analysis therapy, which has been proven to be effective for particularly young children with autism. And each state is now adopting their own pieces of legislation targeting intensive behavior intervention, early intervention, because we know early intervention and intense early intervention is key to entering kindergarten and being more prepared.
So when we look at transitioning, so we start early, and we now have this generation of kids, this new kids coming up who are targeting very early, very young. In fact, from a medical perspective, we can diagnose children 18 months of age, 2 years of age. So these kids are getting early treatment. But the end result, as we know, as parents of older children with autism, is critically important. So how do you help families plan for that, what we call transition piece, that post-high school piece, when kids are going to be entering the adult world? What are you advising families?
Well, technically, transition begins at the age of 14.
Okay.
I believe it even starts before then, because I think that by about 8 and 9 years old, you have a pretty good idea of your child's cognitive ability. And you can start directing their instruction, their programs down a road that may be more academic for some kids and maybe more functional for others. And when I say functional, it's again about making them as independent as they can be. Not that you give up on the academics, but that the academics now have much more to do with jobs and being more independent, shopping, what have you, things like that. So I believe that it starts much younger than 14, but particularly at the ages of 14, that's when the child is now invited into their own
Now, is that a benchmark legally?
Legally,
that's all states in the United States?
Yes, that's under IDEA, which is the law that governs special education in this country. So they're supposed to start, the schools are supposed to start inviting the students into their IEP meetings at age 14, and to be active participants, because I find a lot of times the kids, they're not really educated themselves on what the IEP meeting is all about, and we need desperately to make our young people develop some of those skills to be self-advocates, because the most successful type of advocacy is when people with disabilities advocate for themselves.
Couldn't agree more on that. What about the kids whose function may be lower, who are not verbal?
I still have students that are nonverbal that can learn how to advocate for themselves. Certainly they need different modes of communication, so for those kids we're going to teach different ways to communicate. My experience is if you don't teach a child how to communicate one way or another, because not everybody's going to communicate verbally.
Exactly.
They're going to show you what they want, and it may come out in behaviors that you really don't want to see. So whether it's through picture exchange communication, augmentative devices, I have tons of kids so successful with iOS technology right now. The iPads, the iPhones, they're amazing. They may be nonverbal, but you give them an iPad and they're going to town. So tapping into those things, and a teacher can do different types of assessments, career inventories, interest inventories, to see where the child's interests lay, so that she can then start directing their education in that vein, so that when they age 22 and the bus stops coming, they have a skill They have had some exposure to community-based instruction, which is work outside of the school building.
Yeah, I was going to ask you, is there any mandate on that? Do schools, no. Do schools don't have to provide that link between school and community?
Well, vocational rehabilitation is a national organization that's federally funded, and a part of what they do is they provide some of the linkage. So they will start coming into the school the year that the child's ready to start exiting out. For some of my students that have the larger impairments, I want them even before the end, because I want them to be able to see, this is the student that we have, these are the goals we're going to create, and so that we want to carry that off into whether it's post-secondary education for some kids or job placement. Because not everybody, even typical kids, they're not all going to go to school after they graduate, and that's okay.
Absolutely, absolutely. Well, we'll be back in just a moment with Stacey Hoaglund.
Now here again is Judith Aronson Ramos. Dr. Judy.
And we're back with Stacey Hoaglund. So Stacey, I wanted to spend a little bit of time talking as two moms who are also professionals. And if you were telling other moms what you've learned the most from your child, because your son is now 17 years old, is that right? And you've obviously had a hard-fought journey, and you've probably veered many different directions along the way. So what do you feel you've learned the most in this journey with your mom instincts, raising a child with autism?
Well, I think the most important thing is to not accept no for an answer. Because just like many moms, particularly with autism, I was a mom who took my child to the pediatrician, and he said, he's fine. What are you talking about? He's right. We're supposed to be on the bell curve, the little growth chart. Don't worry about it. And so I didn't for a while. Until I had a friend who said, you need to take this further. So, and had I not, I probably would have missed out on a lot of years of early intervention services.
And I would have to echo that, because actually I was a general pediatrician turned developmental and behavioral pediatrician when I really needed to help my own daughter. And my colleagues, who actually were fellow physicians in my own office, said, you're being neurotic, she's fine, it's all okay. And actually she wasn't okay. And had it not been, it wasn't my physician training, it was my maternal instinct that said, this is a problem, this is not working here, I'm not sure where we'd be. So hopefully, I'm hoping this new generation of physicians coming through are more informed. We still have a really long way to go.
Yes, we do, because I'm still hearing that same story.
And it is the same story, because as a specialist, I'm not a general pediatrician anymore. I'm dealing with pediatricians all the time, and some are quite receptive, and others still, at this juncture, can be what I call saboteurs of the process, because a parent really doesn't want to hear this information. Yet, if we don't aggressively treat a tumor, it can turn into cancer. Same thing with autism.
So, and I mean, I've actually heard physicians say that they don't want to give bad news to families. And I know, as a parent, you know that news is very difficult to hear. But when you know there's something that's just not right, developing appropriately, you have to do something, because we know as a nation, we have enough data behind the fact that early intervention is key, and you miss it. If you don't go by your instincts, and you just let the physicians tell you, he's fine, he's fine, he's fine. Well, then he's 5 and he's falling apart in kindergarten. So you can't wait.
And I'm optimistic, actually, and the optimism I share with my parents is very sincere, because as I've seen so many kids do so well.
Yes, tremendous. I mean, my son came from being, classically autistic with a lot of intervention from just us as a family, because I didn't have a lot of dollars to spend hundreds of $1,000s on private therapies. So I educated myself, and I just got in there. We shut the TV off, and we got in his face, and we have a tremendous outcome. He's worked very hard.
And empowering parents, I think, is really what it's all about, because unfortunately we live in a time where there aren't a lot of therapies, and we discussed the insurance issue earlier, and the idea that there are going to be all of these services that are going to be covered either through public expenditures, private insurance, they're going to help make our kids better. That's not how it's going to work. I think parents play a critical role. So
Nobody, whether it's the school system or Medicaid, your insurance company, nobody's going to come to you with a silver platter and say, what would you like? Parents have got to educate themselves, and they've got to advocate. That is how change comes about. With anything when it comes to public service. If parents or the community doesn't get together and rally with our legislators, both at the local, the state, and the federal level, we will not see change.
we want to thank Stacey Hoaglund for joining us today on the Dr. Judy Show.